So the key accreditation standards, I keep talking about ESQA. So ESQA evaluated us to see if our standards were um, meeting expectations, meeting the needs for international accreditation, and the focus was patient-centered and organization-centered. So that is a big part of what we do. So with patient-center, and these are the actual standard titles. We've got privacy, rights, and responsibilities. So making sure that patients are aware of what's going on, access, assessment, and continuity of care, looking at how patients attain services, what are we doing to determine what services need to be done, what happens after the services are done for continuing care, the provisions of care, medication management and use, very important piece there. If applicable, the surgical and anesthesia care, and diagnostic services and procedures. So while many of these apply to all levels of care in healthcare, there are some that don't. So in my outpatient clinic, if I'm a primary care physician and I'm not doing any surgical or anesthesia care, those standards wouldn't apply to us. So we wouldn't be measured against that. So there's no need to do policies and processes on those part. But everything on this screen is about how the patient is being cared for, that they're being educated, that they're understanding of what is happening, why it is happening, and that they or their loved one who's in charge of their care are fully aware of this to promote this patient safety and quality of care on that. The organization center portions of our standards are corporate governance and leadership, quality improvement and sustainability, staff planning and continuous performance, health records and information, infection control and hand hygiene, and facility safety and physical environment. Any of you, and I've seen a couple of folks are doctors, so I'm like, they're probably rolling their eyes going, this is not exciting part. But when we look at healthcare accreditation, we have to look at the entire process and the entire system, from who's leading, who's making the final decisions. Big important part. Are there some clinical people involved in that? The quality improvement and sustainability. While data might not be everyone's favorite, it's important to see what is working, what's not working, how they can continue to help their communities and help their patients on that. So that is why when we have surveyors, we often have a mix of clinical and individuals who are more on the administrative part to look at the areas and portions that are very specific to them.